So welcome to The Culture for another video today where we're going to be discussing a bit of a case study surrounding thoracic outlet syndrome for a low bar squatter. So we've got Dean here, one of our younger lifters at The Culture, who is starting to put together some pretty decent numbers. He's on his way to junior nationals, and in his last two meet preps, he's complained of some sort of nerve, just sort of discomfort across the posterior side, so across the radial nerves if he spins around. So when he goes into the low bar position, and when he sits there, particularly under heavy loads, so higher intensities, he starts to get a little bit of like posterior nerve discomfort. So we start to see, or he starts to feel, like tingly feelings. He starts to get a little bit of neck pain. He also gets sometimes some discomfort in the hands and the extremity of the arm. Sent him to a osteo who threw around the idea of thoracic outlet syndrome. And it's something that I've heard a lot about through my time under Eric Cressy. But never have I seen people talk about it in a powerlifting sense, so squat, bench, and deadlift. Although now that we're starting to look at it a little bit closer, I feel like it's going to be covering a lot of people's discomfort, particularly in the upper extremity, for squatting. Seeing as you've got a heavy bar on their back, compressing down and putting weight down onto their rib cage, really, and compressing a lot of the nerves. So thoracic outlet syndrome is when the nerves or the vascular system that comes out of the neck and runs underneath the collarbone space in between the first rib and the collarbone. And those sort of structures get compressed during movements, or particularly when the arm goes overhead or in forward head posture. We get some auxiliary breathing muscles, so the SCMs and the scalene muscle group that can compress that compartment and can really compress those structures passing through there. What we get then as a result is nerve discomfort. We can sometimes lose feeling in the fingers or down the posterior side of the forearm and the extensor muscles. Dean was experiencing that, so we did a few things to hopefully improve that based off the osteo's recommendations, and we actually got some really good results on the back end of his recent prep. So when the weights were heavy and the discomfort was at its highest point. And so we're going to go through those today. The first one is lat hang breathing. So this is an exercise that we use with a lot of our people here at Melbourne Strength Culture in a powerlifting population for people who are heavily depressed, retracted, and posteriorly tilted. This is a really good exercise that we do to elevate the shoulder blades, open up the rib cage, and allow a little bit of upward rotation of the shoulder blades. So here we have Dean hanging off a barbell. He's in a supinated position to try and shut off a little bit of lat. We're going to be getting great lat length in this position, and we're actually going to allow the rib cage and the collarbones to sort of start to separate a little bit. And we're allowing some space to be made in that range. What Dean's doing is he's going for 3 sets of 5 breaths. Every time he inhales, he's trying to get air into his upper back, so he's trying to fill his upper back with air. What this will allow us to do is allow us to draw a little bit of flexion through the thoracic spine, again in powerlifting and for heavily depressed, retracted and downwardly rotated populations. The thoracic spine can often get caught in an extended position and struggle to get into a flexed state. So this is a great exercise for us to not only increase lat length and try and elevate some of these structures that may be compressing the thoracic outlet, but also allow a little bit of flexion through his thoracic spine. The second thing that we did was some direct SMR work for his neck, scalenes, upper trap, and that whole area through his neck. So let me move this bar out of the way. So in this position, we worked on the subclavius, so underneath the collarbone here, as we talked about in terms of compressing that thoracic outlet. The subclavius can pin the collarbone down onto the first rib and actually close down that space and compress the nerves that run through the thoracic outlet. So some direct scalene release work with a ball against a rack, as we see here. About 1 minute's worth of work. What we also like to do is actually move through some ranges with the shoulder whilst we're doing that and trying to open up that space a little further. The second thing we did was we got the thumb and worked through the scalene group. So all we taught Dean was, if you come in, Charlie, come in from here. So just in front of the upper trap there, we actually got him to stick his thumb. The scalene group, you should feel some superior to inferior muscle fibers, so running straight up and down. And then what we did is we pinned that muscle group down, and then we just moved the neck to the contralateral side, so across away from the thumb. And again, we did about 15 to 20 of these sort of like tack and release sort of ideas. The last thing that we did with Dean, a lot of these muscles up around the neck that compress the thoracic outlet are also auxiliary breathing muscles. So when we're in a very extended position, as a lot of power lifters are, the diaphragm's function as an inhaler tends to get reduced, or it's not in an efficient position because of the extended position. And we know the diaphragm likes to have a ribs down zone of apposition in PRI talk. So what we did with Dean is we also did some 90-90 breathing, which will just overlap here as an oversight for this video. Some 90-90 breathing where we really focused on the diaphragm and pumping through the abdomen and the rib cage rather than getting a lot of elevation and neck involvement in that breathing. Again, because the SEMs and the scalenes can actually elevate the rib cage on inhalation when the diaphragm is not functioning optimally. I've put a blog on our website, melbournestrengthculture.com. It is in the description box. If you want to learn a little bit more about these muscles or this idea, please go and read that. I also want to just open a conversation on this topic. If you're somebody who has felt this sort of nerve pain on the posterior side, or if you feel any discomfort in your extremities of the arm, loss of feeling, sometimes loss of color in the hands, as a result of low bar squatting, if you could please email me or just drop a comment in the comment section in the comments below. That will really help because I just want to open a discussion on this idea. As always, thank you for watching. If you have any comments, leave them down below. You can follow us through the links in the description. And as always, happy lifting and welcome to the culture.